Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and this morning I want to talk about high angle cases, or this is where somebody has too much vertical height of the lower third of the face, and this messes up the appearance tremendously, especially on women and things. It really messes things up. And what causes them usually, if may have some genetic reason to do it, but this is not something you can deal with very much. But the thing that causes their parents to be that way might be doing something wrong as far as breathing. If you breathe through your mouth, your tongue is in the bottom arch, and you breathe over the top, and you don't swallow right, probably. With most of these cases, they're tongue thrusters, and they continue the infantile swallow pattern. Now, if you try to swallow and not bite your teeth together, just see what you do. Now, I've shown people how to do that so much that I can do it pretty easy, but you have to kind of put your tongue up there and swallow without biting your teeth together. And if you swallow for a few thousand times a day, and I have never counted anybody, but there's a lot of times you swallow and you bite your teeth together if you're swallowing with an adult swallow pattern. Now, a child nursing doesn't swallow that way. They have to learn pretty early not to do that. But if a person carries this infantile swallow pattern over in an older they get, the worse it gets. And so the dealing with these is dealing early and stopping the problem that causes it to happen. So let me get into these cases and show you. Now, if you see somebody developing that, stop what they're doing, watch what they're doing. You could reduce the number of teeth, and you put the same pressure. And if you get them swallowed correctly, they put more pressure on the teeth, and you can get the vertical height this time kind of go down. In some adults, though, it's very difficult to lower this vertical height of the face. I'm going to go on this young lady that we got here. We won this case, and she looked terrible when we started out. You see, there's just too much height in the face in here. It's way over what we would divide the face is. See, it's something like that much too much in the facial structure there. And if you look at her teeth, everything else looks great on this young lady. And here's what was wrong. She had too many teeth up here, and one of her cuspids, her central, came out above the lip and messed it up, and this made a hideous smile. And the mother kept pushing me. We had to start this young lady early while she still had a bunch of deciduous teeth. And the mother kept telling me, says, well, the neighbor down there only took them so many months to get their teeth straightened, and you've been going longer than that. And it just irritated me the heck. The mother griping about this, she didn't seem to know what we were doing. And so I just put up with it, though I wanted to kick her, really. But I certainly didn't do that. Now, so we set out to lower this vertical height of the face, excuse me, and straighten the teeth up. So I'm going to go through this client. I've got a lot of pictures on this young lady. She was biting her baby teeth together, see. But you got to get in early. And I never could find a point to get out. And so you just got to carry the case right on through till all the teeth come in the mouth. So you can see the anterior part is crowded like that. And we came in, and I think we widened the angle, and we used a J-hook type headgear, optical headgear, and you can move this point up here and you pick up the back teeth, or you get it up here and pull up and get the anterior teeth up. You can change the angle that you're raising the teeth with this type of headgear here. You can go from the back to the front. Now back here, we're picking up the back teeth more here. And here it is, another angle. All right, we line these teeth up with a flexible wire, and show you again. We were bringing these upper teeth in. You see the wire going here just moved up into the tissue around here, but we were sinking these molar teeth together. Now what caused that? Let me go back here. It's this headgear we had, but we were lowering the teeth. In other words, we intruded the upper teeth to help get this down. And so you see this wire, we put it down here. Now it's in the tissue. It goes in the tissue. It doesn't mean that they hardly feel that, hardly know that. But you got a problem with taking the arch wire out and changing it. And we brought this tooth down a good bit with that flexible woven wire. This was done in 1974. And I'm having a hard time getting people doing some complicated orthodontics. And I've got cases that go back, some of them 30 and 40 years, showing what we did. And I'm treating it, and we're calling it straight wise orthodontics. Now you'll see what we did. You see this wire? We buried that tooth up. That headgear was hooking in here. It carried that tooth up, you see, took it out of occlusion. And then these are baby teeth. We had to wait on them. We took some bicuspids out early on her. And now there's this another, you see the headgear part was going back to that tooth back in here. And we were picking it up from out here, and so most of the weight was on this permanent 6-year molar. And this is a baby tooth that stayed in, and you lost it. Well, when she lost it, this 6-year molar took over. Let's go back and look at that again. You see, well, that's the baby tooth was down touching, but when she lost it, we went up to we had the 6-year molar going up. So we had to work on this young lady while she was in the mixed dentition to get this down as much as we could. And so now we've got this looking good, pretty good, because this was 75, and this we had to use bands. We didn't have brackets back then, so we used bands to do that. We changed that arch wire, see, and put it out here. Now we got it on the outside of the gum tissue, and she's going to bite down on this, but she'll lose that baby tooth, and we'll lower it again with that. Now, this is some time later. Look at the improvement that we have made. She's still a little bit higher there. Now this picture right here is almost perfect. The height of the facial part across here, just about ideal. And the mother kept pushing me to finish it up. She didn't realize that we had to go through her deciduous teeth, let her permanent teeth come in. We eliminated some bicuspids doing this. Now there's a smile, and we're still just partially banded up. She's lost these baby teeth, you see. So now the bite goes down on the molar teeth. So you see the bite closed too there. And now she's biting the molar tooth together back here, and we've got another baby tooth coming out there. Now the bicuspid is missing, but we're working with only one bite and a cuspid, if I remember correctly. And we will straighten this up, line this up, and use this extra space right in here. with their cuspid teeth. Now we're finishing the case out. We have everything banded. We've got the thing down, and we close this space up, and we have reduced the vertical height of the face here. And this is the band that we had. This was, see, we were in 1978, but I had to wait on her to get her teeth in before I could finish it. And the mother kept aggravating me, wanting me why I was take so long doing it. She didn't understand what we were doing. So you try to educate the parents and the child and everything why you have to work so long to finish up a case like this. All right, we're going to close that space up and we'll finish it up. So here is the models when we started. There we are when we finished. Models when we started, when we finished. That's 82, 73. So you got a long time to work on this person. But, and here's the way the upper arch, we actually made it bigger even though we took out some teeth. You see the round deal, we fixed it, fixed her mouth better. There's the upper retainer we put in. We put a bite plate so she couldn't close any further too there. And that's the lower arch after we finish. And now this is the 6-year molars, the 12-year molars, the second bicuspid. First bi is gone, cuspids, laterals, and everything lined up in a good way, coming around like this. The cusp of these teeth fitting on that way. That's her 73. That's the bottom of 82. And here the young lady is after we finished her up. And that's her closed picture together. And there's her smile. You see a little bit of gum tissue. Let me see if we show where we went from here to there. Now, the mother really hacked me off trying to want to know why I was so long in doing the case. But the young lady realized what it was. And after she got out, she won a high school beauty contest. And she came by the office and thanked me for what we had done for her. And that is something that is very rewarding to the person doing it. And that's why I loved orthodontics, what we could do to somebody. If you had left this person alone, what a mess that would be for that person. And this is what you can do, and I want you to know you can do it, and this is why we're calling it straight wise orthodontics. We use the in and out and tip and torque and everything with straight wire, but we have added a lot of things to straight wire, and we can straighten anybody's teeth, regardless how old they are. You can do it. Every tooth movement you can make, I think we can do it with this straight wise stuff, from the TMJ problems to everything throughout life. And as long as they're living, we can do it. We show that in our cases. And so I hope you'll tune in to our deal. And I don't mess with the starting stuff, but there are other organizations that do that. There's another one with the Academy of General Dentistry they're excellent on starting the case up. But we want to show you how to do the tough stuff, and this is one of the cases like it. So thank you for watching, and I hope you have problems that you go to our videos. Now, we've covered nearly everything that I can think of. It comes up in orthodontics, except I don't mess with cephalometric stuff. I look at the I take steps on everybody and look at them some, but that doesn't tell me what to do. I look at that person across the room and know what needs to be done. So I thank you for watching, and we will try to show you how to do this, and don't be afraid to try. So I'm going to say goodbye and close out. I can get over here and stop this.